Patients of obsessive compulsive disorder continue to suffer for days to years because as a society we fail to recognize that repetitive behavior is not their craziness or their choice. It is a disorder, an illness, mental health problem, which is an improvable thing. I had an appointment of a lady some 2 months back, and she was expected to come at 10 a.m. She didn't turn up at 10 a.m. Then there was a call of her husband at 10:15 that we need a rescheduled appointment at around 11:15. I confirmed that, but they didn't come at 11:15 even. Again, I had a call at around 11:20 that we are about to come, and I would be coming by 12. I said, okay, that is all fine. But they didn't turn up at 12 even. And when I was about to shut down at around 1, they, the husband as well as the patient, they came in to the clinic at around 12:15 p.m. So I was a bit annoyed. Husband extended apologies. But when I requested an explanation, he said, that's not what I wanted to consult. I said, what? He said that my wife was, and we were dressed up and we were about to leave the home at 9:30, 9:35 itself. But my wife had a natural call and she entered the washroom. And she continued to be in the washroom from 9:40 to 12:20. And we had an altercation from two sides of the door. I was yelling at her, I was shouting at her to come out, but she was not coming out. So she was there in the washroom for 2.5 hours and more than 2.5 hours, leading to altercations and everything. But she wasn't coming out. And this thing happens to me and my family each day. He told me she spends around 7 to 8 hours in the washroom itself. She was she was a teacher previously, which she stopped doing as a profession. She stops doing daily chores. She was unable to make the tiffin for the kids as well as lunch for the husband because most of the time she would be in the washroom. I turned to the lady. She was quite anxious. She was in tears. She just said, I just feel to kill myself. I feel like I'm getting crazy, crazy, and crazy. I can't stop myself. She told me that when she enters the washroom, from the morning itself, first of all, this thought comes up that your hands are dirty. Even if she is not doing anything, she is taking a tea, still the thought would come that your hands are dirty. She can't stop it, but she handles it. Then after she goes to the washroom, somehow she first avoids everything, but if she enters the washroom, then these thoughts, they become overwhelming and they just control her. She says that I can't stop them. I wash my hand once, I know they are clean, but still the thought would come. Still, I would keep on washing them and rubbing them, and I do it once, twice, hundred of times. At times, I have a presence of because of rubbing them on a towel or anything else. And once I wash my hand, I feel like I have spilled the dirty water on the tap. I have to clean the tap. Then I have to clean the floor. I have to clean the bucket too. And then the walls. And finally, I have to take a bath and wash my head. And then only I can come out. And it takes a lot of time. I know I'm totally crazy now. If they have a right, I feel like banging my head. I feel like hitting them. That is the family members. It has spoiled me, means I don't think it can be helped, she said. She was not meeting her and any of her friends or family because she didn't like anyone to come to her home and see that she is locked in the washroom most of her time, or she would not visit any of her friends or family because she didn't find comfortable using anyone else's washroom. This much problem was there because of obsessive compulsive disorder. This lady was suffering from obsessive compulsive disorder. Obsessions, they are these thoughts which are unable to be stopped, which are unreasonable, which are not required, which are intrusive. Means she was having this thought even when she was taking tea. She was having these repetitive thoughts that your hands, they are dirty, and she couldn't stop them. They were giving her anxiety. And compulsions are these unreasonable repetitive behaviors like washing hand or washing the floor, cleaning them, that are unreasonable, which are not pleasurable, but the person is doing. He can't just stop it. That is compulsion. And this is a very common mental health problem. Luckily and fortunately, we it's an improvable condition. Unfortunate part, we as a society, we think that every repetitive behavior is just a choice of the person. It is not so. A person is wasting so much time in a washroom or any place that is deteriorating his or her professional, social, and family life that needs help. Now, it is not just the effect of OCD is there on the patient itself that leads to a lot of impairment in the family members too, because that leads to altercation, that leads to at times family members to give in and they repeatedly wash on the request of the family of the patient. OCD may present not just as this hand washing. There are four other type of obsessive compulsive common symptoms like repeatedly checking. The thought comes up, that is the obsession is of a doubt, I have not properly logged in. So the person or the patient goes in, locks, and then the thought comes in, I haven't logged it properly, and he checks it again. He opens the lock, again locks it. Again, after some time, the thought, if he is leaving out, thought comes up, I have not locked it again properly. He checks, locks it again. It could be with the knob of the gas, it could be with the locks, anything like that. And they keep on writing. They have a student who keeps on writing the same thing on a paper, despite knowing I have done it. He keeps on writing it because he feels he have not written it. He has not written properly, so keeps on writing it, cutting and writing, cutting and writing. So this is pathological doubt, which is an obsession, as well as checking that I have done it or not, repeatedly doing it. That is the compulsion. There is one. There are people who suffer from obsession that have not properly aligned or put the things symmetrically. Now, this leads to people making symmetrical alignments or symmetries for minimal 1 millimeter. Even if the things they are arranged, they get irritated. No, this thing has not been placed properly, so they will keep on putting it properly according to them. And they waste a lot of time arranging each and everything. And that is symmetry, that is compulsion of making things in symmetry. There are some religious thoughts, obsessions, sorry, which come up like I have not read the verse properly. I have, if someone is putting prayer or I have not prayed properly, so they keep on begging the God that they are very guilty that I have not read the verse properly. They keep on begging the God, or they keep on reading the verses again and again. That is religious obsession leading to compulsion of repeating the prayers again and again. Similarly, there is sexual obsessions like the images come in the mind one doesn't want, but still the images come in the mind, they keep on waving it out, or they are very scared to meet the people who about whom these sexual images are coming, so they avoid them or just wave hand or something like that repeatedly. They try to avoid everything. So obsessions could be of dirtiness or contamination or doubts. There could be religious, there could be sexual obsessions, as well as there could be related to symmetry. The compulsions could be of washing. Most common one is washing, along with that of then checking everything, checking the lock, checking the knob, and wasting a lot of time in it. And then after religious, doing repeated prayers or giving hand repeatedly, or making aligning things perfectly as if needed. OCD is an improvable condition. As I said, we must recognize in the family members, in the society, if anyone is suffering, means if the repetitive behavior is more than what is we do in general as a population, say every time, even we at times when we are going on a vacation, we double check our lock. That is all acceptable, that is all fine, double checking is fine. But also thinking about a person who keeps on checking the lock for half an hour, he has to leave, but he has to leave and catch a train or a flight, and still he is just checking the lock. That is problematic, and that can be helped. Rather than getting annoyed on these people, we need to be aware of their problem. We need to empathize on them with them, and then we can help them. OCD is an improvable condition. We must recognize, we must help, we must make them aware that it's not okay. It's something which can be improved.